Have you ever looked in the mirror and noticed something unusual about your skin? Maybe it was a rash that wouldn't go away, a strange mole, yellowing around your eyes, or constant itching that seemed to have no explanation. Most people assume these changes are just minor skin problems. But sometimes, your skin can be one of the first places your body shows signs that something else may be happening beneath the surface. Before we begin, here's a quick disclaimer. This video is for educational and informational purposes only and should not be considered medical advice. It is not intended to diagnose, treat, cure, or prevent any disease or health condition. Many skin changes have harmless causes, but if you experience persistent, worsening, or concerning symptoms, consult a licensed healthcare professional for proper evaluation. Now, let's take a closer look at 7 skin changes you should never ignore. Your skin is the largest organ in your body. It protects you from bacteria, viruses, harmful sunlight, and injury. It also helps regulate body temperature, prevents excessive water loss, and even produces vitamin D when exposed to sunlight. Because your skin is connected to the rest of your body, changes in its appearance can sometimes reflect what's happening inside. That doesn't mean every skin problem is a sign of a serious illness. In fact, many are caused by everyday things like allergies, dry weather, or irritation. But learning to recognize certain warning signs can help you know when it's worth getting checked by a healthcare professional. The first skin change to watch for is yellow skin or yellow eyes. If your skin or the whites of your eyes suddenly develop a yellow tint, this condition is known as jaundice. It occurs when bilirubin, a yellow pigment produced as red blood cells break down, builds up in the bloodstream faster than the body can remove it. Jaundice may be associated with liver disease, gallbladder problems, blocked bile ducts, certain blood disorders, or other medical conditions. If yellowing appears together with dark urine, pale stools, severe abdominal pain, fever, confusion, or vomiting, don't ignore these symptoms. Seek prompt medical evaluation. The second warning sign is unusually pale skin. Everyone looks a little pale from time to time, especially after a poor night's sleep or during cold weather. But persistent paleness may sometimes indicate anemia, poor circulation, nutritional deficiencies, or other medical conditions. When your body doesn't have enough healthy red blood cells, oxygen delivery to your tissues decreases, which can make your skin appear lighter than usual. If pale skin occurs along with fatigue, dizziness, shortness of breath, chest discomfort, or fainting, it's important to speak with a licensed healthcare professional. The third warning sign is persistent itching without an obvious rash. Most itching has a simple explanation. Dry skin, insect bites, allergic reactions, and eczema are very common causes. However, if you've been experiencing severe itching for several weeks without seeing a visible rash, it may sometimes be associated with conditions affecting the liver, kidneys, thyroid, or even certain medications. Persistent itching doesn't automatically mean something serious, but it's worth getting evaluated if it continues or begins affecting your daily life. The fourth warning sign is bruising more easily than usual. We've all bumped into furniture and found a bruise later. That's completely normal, but if bruises seem to appear frequently without remembering an injury, or if they become larger than expected, it could sometimes be related to vitamin deficiencies, medication side effects, blood clotting disorders, or other health conditions. If easy bruising is accompanied by frequent nosebleeds, bleeding gums, or blood in your urine or stool, seek medical attention as soon as possible. The fifth warning sign is wounds that heal very slowly. Your body has an incredible ability to repair itself. Small cuts and scrapes usually begin healing within a few days. When wounds remain open for weeks, repeatedly reopen, or become increasingly painful, it may suggest poor circulation, diabetes, infection, or another condition affecting your body's healing process. This is especially important for people living with diabetes, since reduced sensation in the feet can allow small injuries to go unnoticed. Regularly checking your skin can help you identify problems before they become more serious. The sixth warning sign is a mole that changes over time. Most moles remain harmless and unchanged for many years. But if a mole begins changing in size, shape, color, or texture, it deserves medical attention. A simple way to remember what to watch for is the Xity rule. A stands for asymmetry, where one half looks different from the other. B stands for border, especially if the edges become uneven or irregular. C stands for color, particularly if multiple shades appear within the same mole. D stands for diameter, especially if it's larger than about 6 millimeters. And E stands for evolving, meaning the mole continues changing over time. These changes don't necessarily mean skin cancer, but they should always be evaluated by a qualified healthcare professional. The seventh warning sign is a rash that appears together with fever, severe pain, swelling, or difficulty breathing. Many rashes are harmless and disappear on their own, but a rash accompanied by other serious symptoms may sometimes indicate an infection, an allergic reaction, or another condition requiring urgent medical care. If a rash spreads rapidly, forms large blisters, affects your eyes or mouth, or occurs alongside trouble breathing or swelling of your face or throat, seek emergency medical attention immediately. You might be wondering why so many different health conditions can affect your skin. The answer is actually quite simple. Your skin depends on healthy blood circulation, proper nutrition, balanced hormones, a strong immune system, and well-functioning organs. When one of these systems isn't working properly, your skin may begin to show subtle changes long before you notice other symptoms. For example, if your body isn't getting enough iron, vitamin B12, or other essential nutrients, your skin may become pale or look less healthy than usual. If your circulation is reduced, your skin may feel colder, heal more slowly, or even change color. When your liver or kidneys aren't functioning as they should, waste products that are normally removed from the body can build up, sometimes leading to itching or changes in skin color. Even your hormones play an important role. Hormonal changes during puberty, pregnancy, menopause, or certain medical conditions can affect oil production, pigmentation, and even how quickly your skin heals. Your immune system can also leave clues on your skin. Sometimes the immune system mistakenly attacks healthy skin cells, leading to conditions such as psoriasis or vitiligo. Other times, your skin may react to infections occurring elsewhere in the body. This is one reason healthcare professionals don't just look at one symptom. Instead, they consider your medical history, medications, lifestyle, family history, and any other symptoms you may be experiencing before determining what could be causing a skin change. That's why it's important not to jump to conclusions after seeing information online. A single symptom rarely tells the whole story. For example, dry skin can simply be caused by colder weather, frequent hand washing, or not using enough moisturizer. A rash may be caused by an allergic reaction, a new soap, or irritation from clothing. Even itching can sometimes be explained by dry indoor air during the winter months. On the other hand, if a skin change appears suddenly, continues getting worse, keeps coming back, or is accompanied by other symptoms like fever, unexplained weight loss, persistent fatigue, severe pain, or difficulty breathing, it's important to seek medical evaluation rather than trying to diagnose yourself. Another good habit is taking photos of any skin changes that concern you. If a mole changes over several months or a rash keeps returning, having photos can help you describe what you've noticed when speaking with a healthcare professional. It's also helpful to pay attention to when the skin change first appeared. Did it happen after starting a new medication, after traveling, after spending time in the sun, or after eating certain foods? These details may provide useful clues during a medical evaluation. Remember, your skin isn't trying to scare you. It's simply communicating that something may have changed. Most of the time, the explanation is harmless and easily managed. But learning to recognize unusual changes and knowing when to seek professional advice is one of the simplest ways to take better care of your overall health. Think of your skin as one of your body's earliest messengers. The sooner you notice something unusual, the sooner you can decide whether it's something to monitor or something worth discussing with a licensed healthcare professional.